Hello, my friends. Tim Mikhelishvili here, CEO and co-founder of Amadev Pharma, and I hope all of you are enjoying the 2024 Paris Olympics in the summer. I've seen many of my colleagues in pharma and biotech post a lot of their photos on LinkedIn. A lot of our colleagues from Sanofi and others as well. So I'm quite jealous in a good way because always been my dream to attend the Olympics, to feel that Olympic spirit, which we have created in medical affairs, in pharma and biotech globally over the last 3 years. And that's what I'm here to talk to all of you about here on LinkedIn. You're going to see me every day this week on LinkedIn. I challenged myself this summer to make sure that I convey to you the meaning of this event for all of us who have experienced it, who have lived through this, who have invited Olympic gold medalists, global healthcare quality experts who are at our steering committee, who meet every 2 weeks tirelessly in order to continue to raise the awareness and continue to improve the quality, the educational quality of this event. And so this is an informal live here on LinkedIn, on Facebook, as well as on YouTube. For those of you who follow me, for you to ask questions. So bring your questions, your comments, as I'll very quickly provide you with just the overview of this event, what makes it so special, such a memorable experience, and why it's a timely opportunity, why you need to sign up today for this event, which takes place October 1st through the 16th. But the early bird discount pricing ends August 8th. Okay. And that's one of the reasons why I'm going to be going live every day this week. You're going to see a lot of me in order to make sure that it makes it to your feed so that you can share it with your friends and colleagues as an important opportunity, an unforgettable shared experience, and deep networking, what I call a deep level of networking, a way in which you involve others on your team across the globe, okay, in decision making, in a learning and development workshop environment. And that's where mentorship happens. That's where new ideas are derived, and where you can really share, make your impact, okay, in your industry, in your field. So I'll post the link again to the registration, but let me go very quickly and show you how you can register and what you'll see on the registration screen. All right, just bear with me here. Okay. And so this is the attendee registration. There's many ways to register this year. You can register as a competitor, as an attendee. As an attendee, you get the benefit of voting on some of the best innovative ideas. And over the 3 years, I'll tell you the pedigree that this event has reached by now, and some of the outcomes that our winners, our previous winners, have disclosed and have shared publicly with others as a result of this event. If you're a student, we are welcoming you to also share your ideas. We're closing the generational gap of innovation. Vendors, consultants who work in life science, who are tirelessly providing their innovative solutions. And that mixture of ideas between full-time employees in pharma, in biotech, in medical affairs and beyond, or anyone who has worked with medical affairs, clinical development, commercial, if they have solutions or questions for medical affairs in order to be able to improve our impact on healthcare quality, on patient and business outcomes, we welcome you, as a solutions provider. Also, on a case-by-case basis, we are offering a medical innovation scholarship registration. So this will be determined by our steering committee of industry leaders in pharma and biotech. So for various different reasons, which may hamper you from signing up and paying for your registration, we're going to review each of your applications as well, and we invite you to also choose that option. However, if you work for pharma companies, we've had Takeda, Astellas, Roche submit their ideas and win as well. And so if you work for a pharma company, if you're an employee, there is a strong business case for the learning value, because it's not just the competition, but it's also learning and development that takes place through the expert panels, through our virtual community, okay, through the Whova app. And you'll see here, you'll see this logo of Whova. Okay, and this is an app that's used by many scientific conferences, okay, medical conferences. That's very simple to use. Okay, we post articles, again, we share ideas, we share polls, we poll each other, and we generate a lot of new evidence as well. We share latest standards or latest overviews and reports in healthcare and digital health and various timely topics as well. Competitors, so healthcare student competitors, healthcare nonprofit attendees. So if you work at a nonprofit or organization, or if you're a patient advocacy group, also welcome you to sign up. Okay, so there's 3 days left for early bird pricing, and take advantage of this opportunity. Okay, now let me share with you a little bit about the expert judges, the kinds of ideas, the themes. This year, the theme is Discover New Power in Medical Decisions. And the reason for that is because medical affairs is a multifunctional, very diverse profession and specialty within pharma. It touches on all areas of pharma: sales, clinical development, education of physicians. And it's exactly that medical education that is now taking place in various different ways, that also is now competing for the medical affairs professionals' ability to synthesize very complex information, vast amounts of information, and then translate it in order to bring those insights into decision making, help physicians, patients ultimately make best decisions. However, the volumes of data, as you know, in publications are doubling every 2-3 months. We have AI and various different technologies and sources of information that physicians are now using in order to guide their decision making. Okay, right? So as new competition emerges, medical affairs needs to differentiate their value and their impact and be innovative about it. But more importantly, currently there are clear limitations on the computational power, on the sources of computational power and energy that is being consumed, that is limiting the affordability and access of a lot of these innovative AI solutions or technology solutions as well, within pharma, outside of pharma as well. And that's why what we're emphasizing on this year is how to not just consume, but to generate new sources of power that guide medical decisions. All right. What are some of the new innovative ways to make sure that medical affairs is confident that they are a decision-making function, a decision-making profession, and that they in turn can help the healthcare community make better decisions in innovative ways? All right, so that's in essence what we're looking for. And there are 4 categories in which we're going to see competition take place. And they are in operations and technology, in patient centricity, medical insights, and scientific communication. Okay. Now, what are some of the expert judges? Who are some of the expert judges? Okay. So for that, I'm going to share with you that we have a very diverse panel of experts in healthcare quality, in leaders in medical affairs, medical education, as well as investors this year. So what's new about this year's event is that we have 2 life science investors who are seasoned experts and leaders, who are also going to be able to provide their input in your ideas that you submit. Okay, and so this is a tremendous opportunity in terms of the track record that we've had already. We've had innovators from So we've had innovators from the medicine, from the digital health, rare disease specialists, rare disease patients themselves, pharma, being able to, in sports medicine, yes, sports medicine, submit ideas, go on to then win at major other innovation competitions, raise millions of dollars in seed funding. And so this year, we're looking to make even more connections, right? And increase the probability of that success that we've already established. We have a special guest as well, a keynote speaker who's actually at the Paris Olympics, Bob Beamon. Bob Beamon won the Olympic gold medal in the long jump in track and field in 1968 in Mexico City. He went to the Paris Olympics this year, and he's going to share some insights from the performance. He's going to break down performance of that long jump event in track and field, which has withstood the test of time in terms of world records, which take decades until they're broken. In fact, his held on for 23 years until it was broken in 1991. We have other keynote speakers who are leaders in obesity medicine, as well as more to be announced very soon. But most importantly, the highlight of the show is going to be the competition and the shared experience that's unforgettable. So as I see a lot of you in medical affairs, in pharma, make a lot of transitions, announce the changes to your current roles as you're moving across different responsibilities in leadership within pharma and across different types of therapeutic areas. This is going to be the place to network, to find partners, to find potential members on your team, new members of your teams, as well as to find new opportunities, new professional opportunities, personal as well as partnership opportunities. So I look forward to seeing all of you. I'm going to the screen is currently not allowing me to share. Okay, so this is our steering committee. I hope you're able to see this, but this is our steering committee that I told you about earlier. And here is our track record of various different speakers that have participated. Longevity Medicine Platform Pharma CEO, award-winning patient advocates. Last year we had Gary Hall, a 10-time Olympic medalist, 5-time Olympic gold medalist in swimming. And you can read about some of the ideas, and specifically at the Medical Affairs Professional Society's innovative blog article, as well as on the Amadea Pharma website. Okay, we held live trials last year, and the amount of ideas and the caliber of ideas, the quality of the ideas was just unparalleled. We have a comment here from Darshan. Okay, Darshan, first of all, thank you very much, my friend, Darshan Kulkarni. Compliance, he says, affecting everything MA does. Yes, a great reminder for us to be compliant, collaborative, and also reach new heights of impact and healthcare outcomes. And so these are some of the ideas that we have already. Okay, 6 ideas from Medical Affairs Innovation Olympic trial winners. And they're coming from all over the world this year. We have new competitors from the Republic of Georgia, from Greece, from Africa as well, from Rwanda, Rare Disease Life Project. These are all ideas that won the Olympic trials, and they're going to iterate, modify their ideas, enhance them in front of the judges. Okay. And this was a virtual event. Okay. Virtual event that took place in April this year. You see some of our competitors here. This is just a preview. And here is the format of the event. Okay. The registration started July 3rd. Remember, again, to register. We have 3 days to take advantage of the early bird discount. Okay. I'll drop the link. I'll post the link on LinkedIn. And so October 1st, we'll have our opening ceremony. And just like the Olympics that all of us know about, this event also takes place for 16 days, right? 16 days of glory. Those were the memorable Olympic highlights videos that many of you hopefully remember. But it's at your leisure, on demand. We vote at the end of the first week. We eliminate some of the competitors, and then we vote on the second week. As the pool of competitors narrows down, we're going to have then live stream semifinals and finals in each category. And we're going to give away $1,000 in each of the 4 categories. Okay. And which I already mentioned to you. I spoke a little bit about who should compete. But besides all the major awards, there's also going to be special recognitions. Okay. And these are some of the special recognitions that I just want to highlight today. Okay. That ultimately recognize various different aspects of promising ideas, right? Those that are the shortest, the simplest to apply, or those that maybe address possible hurdles in the presentations. Most forward-thinking ideas, the Idea Long Jump Award, Idea High Jump Award, most idealistic, lofty concepts. So we thought of all the various different types of, well, not all, but many, many different qualities and attributes of ideas that may not win in one competition, one event, such as this one, but they may win in other major competitions that you will be able to apply to as well. Okay, other accelerators maybe, if you're a startup, for example. Okay. And these are the voting criteria, by the way. Okay. The voting criteria, this is the one that we've been using for our first 2 years, and we're going to stick to it this year as well. Okay. It's a real-time voting. So you get feedback immediately. Okay. From the judges, or within the same day. You get feedback immediately if it's a live stream semifinal or final. But leading up to that, right, in the first 2 weeks, on every Friday of those 2 weeks, the judges are given about 12 hours because of the the geographic location there where that they may be in, they may live in, to vote. And so you receive the voting based on validity. How relevant is the idea to the access, continuity, and quality of healthcare, right? How does it correlate to the intended outcomes that you present? What's the causality, the novelty factor, as well as the applicability? So those are the 5 criteria scored from 1 to 10. So for more information, my friends, connect with me, ask me any questions. I will, again, post the link in the comment, and you're going to hear more about this event every day this week. I'm going to go live on LinkedIn and YouTube and Facebook. Okay? So don't be shy. Make sure to connect with me. This is a great, tremendous opportunity, my friends, that you will remember. It's an unforgettable event, and we want to bring it to more people to create opportunities, professional business opportunities. Have a great day. Thanks.